where we will go over the types, definitions, and differences. This presentation was created by Joshua Lopati, Cheyenne Gooley, Yolanda Alfaro, and myself, Ali Alcala. So the most common tests here are the PCR and antigen tests. PCR stands for polymerase chain reaction, and it detects genetic material from a specific organism. In this case, it is the COVID-19 virus. The specific coronavirus that causes COVID-19 is called SARS-CoV-2. The PCR test is the most accurate test for diagnosis. And antigen tests are able to give results quickly, and they're often referred to as a rapid COVID test. This uses a nasal swab for sample collection, and it detects specific viral proteins. This test is quick, but it is less accurate than a PCR test. Some other types of tests include antibody, rectal, and LAMP. Antibody tests require a blood sample, and they look for signs of previous infections. So they cannot be used for diagnosis of a current infection. This is because it takes time after an infection begins for the immune system to create the antibodies that this test would be looking for. It could take anywhere between 1 and 3 weeks for that to happen. So much less common, if at all occurring here in the United States, are rectal exams. This test is done with a cotton swab that is inserted into the rectum and gently swirled around. These tests detect nucleic acid and would increase detection rates of patients and lower the chance of misdiagnosis. Now, LAMP stands for loop-mediated isothermal amplification, and it's a single tube technique for amplification of DNA. Now, this can be collected with stool, respiratory, and genital swabs. It is a low-cost alternative to PCR technology. So when to get tested, the accuracy of your results, no matter what method of collection, relies on getting tested at the right time. So for the tests that we're doing here, which are PCR and antigen, you would want to wait at least 5 days after exposure to get tested to have the most accurate results. You should begin quarantining as soon as you're aware that you were exposed to the COVID-19 virus. And you should continue to isolate if you test positive. And the CDC actually does recommend that even if you test negative, to quarantine for the entire 2 weeks. This is just due to asymptomatic cases and the possibility of false negatives. So how long does it take to get your results? Well, for PCR, it can take several days. It's typically within 1 to 3. Antigen, you can get your results in as little as 15 minutes. And the antibody test can be anywhere between 15 and 30 minutes, though since it is a blood test, sometimes you will not get your results until the next day. Now, why is testing important? Well, it's important because this is the best arsenal that we have to combat this virus. By getting tested, we're becoming aware of who is infected and what steps they need to take in order to keep themselves safe and the rest of the community. It also lets us know who is at risk for developing COVID-19 based on who they had contact with. It allows us basically to take the steps needed to let people know that there's a possibility they will become sick, to take the steps that need to be taken for the safety of the community, and it will eventually help us flatten the curve and eradicate this pandemic. There are pros and cons to each test. So for the PCR test, some of the pros are that it's minimally invasive and it can be taken while also practicing social distancing. And it does yield few false negatives. Now, on the flip side of that, they can have long turnaround times for results, and that is usually just due to surge times. During the surge that we saw over the holidays, there were reports that people were taking as long as a week, 2 weeks to get their results. Some have even reported never receiving the results at all. And of course, it is still possible to get a false negative. That is usually due to user error or getting tested too soon. And this test can be uncomfortable for the patient just because of how it is collected. It can be a little bit painful. Most people say it's not too bad, but of course it is uncomfortable because you do have to go pretty far up your nasal cavity to get the swab. Now for the antigen test, the pro is that it does have rapid results, so that does mediate the con of the PCR test, which was the time that it takes to get your results. Now, con-wise is you do have to go to a hospital or clinic for this test, so you cannot really practice social distancing while taking this test. Social distancing is also a way that we are trying to combat this virus. So, of course, that is definitely a con because we are taking away that extra step. And then this has very high false negative rates when you compare it to the PCR test. It can be suggested by evidence about 50% for false negatives using these tests. Now, for antibody tests, the pros include being able to tell that you have been infected with COVID-19 at some point. So if you believe you had COVID-19 at some point or another, you can get this test done, and it would be able to tell you whether or not you did in fact have COVID-19. So it's great for people that believe they had it, but didn't actually get tested. This can also diagnose post-infection complication, and you get your results pretty quickly. Now, a big con, especially because we're currently fighting this virus, is that it is non-diagnostic. You cannot get this test to tell you if you currently have COVID-19. It doesn't really do anything in our effort to fight COVID-19 because we're not actively using it to tell you, yes, you have COVID-19, and yes, you need to stay home, and we cannot get in contact with people that you were in close contact with. Because, again, it's not telling us that you have COVID-19. It says that you had it at some point. Aside from that, if someone had a mild case, they might get incorrect results back because the mild case wouldn't trigger detection. And we also do not know how long COVID-19 antibodies last in the body. So we can't really say a timeline of when to get an antibody test to see if you ever had COVID-19. You know, if you suspected you had it last year, are you going to be able to get a test this month to tell you whether or not you did have it based on the antibody test? No, we just don't know. We still need research for that. Now, resco tests, again, they're not super common in the States, but based on the evidence and research, there does appear to be some pros to them. These include increased detection rates and lower chance of misdiagnosis, and is potentially an optimal specimen for the SARS-CoV-19 or SARS-CoV-2 detection. Now, the cons, in my opinion, do far outweigh the pros by a landslide. This test is not convenient for the healthcare worker or the person that's getting the test taken. So for me personally, that is the only one that I care about. I would never get this test for that reason alone. Some other cons include that there does still need to be more research for the effectiveness of this method. And there is no real evidence to suggest that COVID-19 has been transmitted through one's digestive system. For LAMP-based testing, the pros include that it is low cost, fast, and portable. Other pros are that the samples do not need to be extracted for use, and the instrument can distinguish between different infections from a single sample. That's great. You know, you only need the one sample, and it can tell you whether or not you have had many different types of infections. It won't look for just this one. Some cons are that LAMP-based methods, they still need further development. They're not as sensitive or robust as the swab tests that are currently used, and the results yielded with this method are not widely used or accepted to determine a COVID-19 diagnosis. Now, this information we are all intimately familiar with because of what we do for work, but it is related to this topic, so we will go over it pretty briefly. Now, positive cases should stay home and isolate upon getting the results. If they have any health concerns whatsoever, they should reach out to their doctor, as that is obviously the best person to get any information on. And they should definitely take precautions to protect those that they live with, if they live with other people. This would include isolating in a room, sanitizing often if they are leaving their room, and wearing a mask. That would also go for anyone else in the home. Now, if they test negative, it's likely that they were not infected at the time the sample was collected, but that doesn't mean they won't get sick, and it also doesn't mean that they did not have COVID-19. Again, the accuracy of the results completely relies on the person getting tested at the right time. If they get tested too soon, they will likely get a false negative. This is why it's so important that if we can stay home. That is the best way to fight this virus. Of course, it's not always possible, but when it is, no matter what our test results say, we should be staying home and doing our part to end this pandemic. With that, that is the end of our presentation. Thank you so much for your time today. We really appreciate it.